today we're reporting 22,152 new cases of COVID-19. 405 people are currently in hospital, 10 in the ICU. We now have more than 120,000 active COVID-19 cases across the country. However, while those case numbers do continue to grow, and they will continue to grow, as we know, the key metric that we're focused on now is those requiring more intensive levels of support, so hospitalisation. It's important to remember that New Zealand, at this point, continues to experience fewer people in hospital than we've seen internationally. And one of the key drivers of that is the millions of Kiwis who have been vaccinated and who have had booster doses. And of course, our ongoing public health measures continue to play a role. So a few key statistics for you. 86% of the eligible New Zealand population aged 5 and older have now received at least one dose of vaccine. 80% are fully vaccinated. As of midnight last night, 2,390,659 people have received a booster. That's about 72% of the eligible population. And 243,244 children have received a paediatric dose of the vaccine. That's around 51%. All of our DHBs have now had 90% uptake of first doses of vaccination, and Northland, being 3,470 doses away from their second dose target of 90%, will bring them all up to 90%. So my message to all New Zealanders is high rates of vaccination are now making a significant difference in how this outbreak is, the country is weathering the outbreak. So please take up the opportunity to be vaccinated. Please make sure you're boosted. Please take up the opportunity to get your children vaccinated. In terms of the health system response and what it means for our ICU and ward occupancy, those two figures still remain low. We have 80.8% of our intensive care unit or high dependency unit beds in use. We've got 64.5% of our ward beds currently occupied, and 13.9% of our ventilators currently in use. COVID-19 only makes up a very small fraction of those numbers, and so there is still capacity there to respond to increasing case numbers. Across the country, access to rapid antigen testing continues to progress. More than 50,000 people, to be precise, 51,794 people have self-reported their RAT test results through the My COVID record portal. And that's helping us to understand the spread of Omicron, and of course it's helping to contribute to our daily case numbers. I do want to urge people to be patient when they're trying to access testing. There is a lot of demand for testing, and we are standing up more sites and locations for people to be able to get tests every day. There is no need to stock up on rapid antigen tests, and I want to reiterate this message very clearly. This month alone, we have 105 million rapid antigen tests coming into the country. 2 million arrived last night, another 5 million this morning. They are literally arriving all of the time. If you have half a dozen tests on hand, that is more than enough. You don't need to have boxes and boxes of them. And they do expire as well. And the older your tests are, the less accurate they are. So we don't want people stockpiling. It's not like, like as we saw with toilet paper and hand sanitizer and a variety of other things, sometimes there's a run on this sort of thing. You don't need to do that for rapid antigen tests. There will be plenty to go round. Also, while we're on public health messages as well, Healthline and St John's have been reporting increased demand for their services from people who have relatively mild symptoms. So the message here is if you are unwell with relatively mild symptoms, the best thing you can do is stay home. Obviously, even if you're getting a positive rapid antigen test, if your symptoms are mild, just stay home and get better. Make sure you're keeping those health services, including the Healthline services, available for those who need additional support. And finally, for those who experience a decline in their symptoms, so they're getting worse, please don't hesitate to reach out and ask for help. And of course, in a medical emergency, call 111. For many people now, with the high rates of vaccination, getting COVID-19 will be more like getting the cold or the flu, and you will be able to stay home and get better. A couple of other things to do to run through this afternoon. Onto school sports and school activities. We'll be making changes to the regulations around this in the next week or two, and we'll be providing much greater detail. But I want to be clear that those young people who are participating in a school organised activity do not need to be vaccinated. And that includes things like a school sports team that is competing against another sports team that's not a school sports team. The other team will still have to adhere to whatever the public health requirements are, but for the school children, if it is organised by the school, then vaccination is not required. That, of course, does not apply to adults who are coming to spectate or who are coming to support those school activities. The same requirements that have been in place will continue to apply to them, but we want to be clear that those participating in those activities organised by schools don't need to be vaccinated. And finally, I want to finish up with a few comments on managed isolation and quarantine. Cabinet will make decisions in the next week or two around what the future of our MIQ system is going to be. In a relatively short space of time, it is likely to shrink quite considerably as we see demand for MIQ drop right away. From this afternoon, MIQ will return to the previous self-service model for the allocation of rooms, so those who are looking to book a room, and it will be pretty much unvaccinated people who are looking to book a room in MIQ, they'll be able to jump online and book one, and they won't have any difficulty with that because the demand is obviously going to be that much lower. I do want to acknowledge our MIQ workforce once again and acknowledge the significant role that MIQ has played in keeping COVID-19 out of the country. And perhaps if I could, just for a moment, turn our minds back to the 9th of April in 2020, the first day that MIQ was in operation here in New Zealand. The world recorded its 103,000 deaths had been accumulated at that point from COVID-19, and 1.5 million cases had been recorded. In the 2 years, almost 2 years that has passed since then, we have seen those numbers grow. The world has now recorded 5.9 million deaths from COVID-19 and 437 million cases. New Zealand has been very fortunate in the sense that we have had a very low mortality rate and a very low case rate. And that has been because of the hard work of the people who have been working at our border and working in our managed isolation facilities. And as many of them find that that work is coming to an end, I want to acknowledge once again the personal toll that that has taken. As Minister for COVID-19 response, MIQ has been one of the most difficult parts of this job for me over the last 18 months. And it has involved hearing from workers, the sort of thing that they have been subject to, including a lot of personal abuse. They've often been ostracised in their communities, excluded from sports clubs, abused in public, and they have continued to go to work every day to keep the country safe. And so as we start to wind that up, I really want to acknowledge them and also want to give them some reassurance that we will treat them fairly in this next part of the process. They're not going to show up at work one day and suddenly find that everything is gone and that their job is gone. We will be making sure that we treat them fairly. And the final group that I want to acknowledge are those New Zealanders who haven't been able to return to the country as and when they have wanted to. It has been had a significant personal toll for New Zealanders who have been unable to both leave the country because they weren't sure they could come back, and New Zealanders who have wanted to come back into the country, and actually people who aren't New Zealanders but who have family and friends and people who they care about who are here, who have been separated from their loved ones. My message to them, of course, is that not long to wait now, and haere mai, welcome home.